all the attendees and welcome all the panelists. My name is Danish Bahati. I'm a co-chair for APPNA MERIT, Medical Education Committee for APPNA. And I just wanted to give some basic rules and an overview of the day before we start formally. We will have the day or the next 90 minutes divided into 3 half-hour sessions roughly with some flexibility and overflow. So in the first half hour, we will start with the keynote addresses with the basic overview of one of our main project or aim for this year, which is capacity building in primary care and family medicine. And we have the pleasure of having Professor Dr. Tariq Banuri, the chair of Higher Education Commission with us, and then someone representing Dr. Zafar Mirza team, and hopefully someone representing Dr. Faisal Sultan's team from the Healthcare Task Force will be with us. In the second half hour, we will have a very extensive and very esteemed panel who will give an overview of various institutions' participation in capacity building in primary care and family medicine. And if we have time allows, we will do a few questions or at least try to clarify some of the points before we go to a closing remark from our chief guests today. And in the last session, in the last half hour, we'll do a very quick update on various MERIT projects related to family practice, but also many other projects that MERIT is doing in all different subspecialties. So that will be the roughly 90-minute overview of the day. And then to start it formally, let me invite the chair of APPNA MERIT Committee, Dr. Shahid Rafiq, to introduce himself and start with the welcome and opening remarks. Dr. Shahid, please go ahead.
It's a great honor to host all of you from across the world, especially our VCs from Pakistan, Chairman Professor Tariq, Chairman HEC, and many distinguished guests, APPNA EC, APPNA President, Dr. Nahid Usmani, and our MERIT team. This program could not have been successful without your presence. So I will start with the sharing my screen so that we can talk about the overview of, like Danish said, that I will just give a brief overview because the last half an hour is dedicated for the MERIT activity and various subcommittee chairs and the active MERIT members will present those in detail. However, it's pertinent to just give an overview, which will be followed by our President Nahid Usmani to expand upon and emphasize the importance of family practice and why our focus this year of MERIT has been on family practice. So as you know that we started this year of 2020 with various projects, more importantly, family practice. And that is why we had first conference of Family International MERIT Conference on family practice with the collaboration of Rawalpindi Medical University and Higher Education Commission. And I thank both Professor Tariq Banuri and Professor Umar for that great collaboration. It was a huge success. But as you know, as we ended that conference around, this was 4th or 5th of March. And then I came back to US around 13th, I think 13th of March. And this hit, worldwide. Of course, first America, US was, both April, May, those months, and now Pakistan is heading the peak there. And that has disrupted, of course, every activity. However, MERIT team took this opportunity to see what we can do. And we started around 31st of March. We started a daily webinar. It was 11 o'clock Eastern Standard Time in US, which was at that time, I think 8 o'clock in Pakistan. And we brought all the COVID specialists, which included pulmonary intensive care specialist, ID specialist, nephrologist, cardiologist, neurologist, and people from Pakistan who were taking care of COVID patients. At that time, Pakistan didn't have many cases. And I think in some way it was great because it worked towards some preparedness, heads up. We thought Pakistan will never see that, COVID cases as the world have seen, but it was just a delayed peak. So we continued that during Ramadan. We changed it to twice a week, Saturday and Sunday. Then after Ramadan, we are still continuing it. We have put a little twist in it. Our Sunday webinar is now more specialized. Like, for example, we started a series of supporting frontline healthcare workers. So those psychosocial problems, anxiety, lack of resources, going into the front line without maybe proper PPEs, maybe proper protective gears, and seeing those deaths and critically ill patients. So how to support them? That has been a great effort.
1 minute left.
Sorry?
1 minute left.
Okay. So then, yeah, I will move on. So this was all the COVID efforts, COVID guidelines and infographic algorithms. These are being created. And so these are still continuing. Then family practice, of course, I'd let Nahid talk more about it, how our conference was so successful and how we had, follow-up meetings. So this one I would like Nahid to please expand upon more and our vision, and that is still continuing. One thing that I would like to mention, that every time we met Prime Minister Task Force team, Dr. Burki, Dr. Faisal Sultan, Professor Tariq Banuri, and various leaders in medical universities in Pakistan, like Dr. Gondal and Professor Umar and others who are here, that nursing situation in Pakistan needs a really top priority. And so we have started working on that. We have started a special chapter in APPNA MERIT, and Rafat Jan is here today. She will expand upon that a little bit, how she is developing with us the critical care nursing courses. I would like to congratulate our intensivist members. They were the stars of this COVID efforts, at least 10, 15, but a core of 5, 6 intensivists and nephrologists really took it upon and had these various efforts, and they're still ongoing. There's a discussion board, there's a Saturday webinar, there's a Sunday webinar, critical care nursing course has been created, and also we are starting a nursing webinar, and the first one will be on 11th of July. Finally, I just wanted to briefly, Danish, a half minute, these few new initiatives. Number one, the ER, we are very glad that Professor Junaid Razak from Johns Hopkins, who is also the co-director of Center of Excellence at AKU, has a big grant for NIH from here, Bethesda, for developing the capacity building, research in capacity building in trauma and emergency care in Pakistan. So he's joining forces with UK. Dr. Taj and him are co-chairing a conference in September. So this will be a great initiative from APPNA MERIT. I think that would be a great contribution. Further, nephrology, Dr. Abbas Masood is here. He's starting dialysis and interventionist aspect and various programs in that. Sleep medicine and pulmonary medicine intervention will be our new initiative. Like I said, psychosocial support on frontline will be ongoing. In APPNA Academy, we have started many courses. Movement disorder course is ongoing. It's the 4th year, and Dr. Danish Bhatti run that. Stroke course is going to start next 1 month. Critical care nursing course is being developed. We are also having a stroke registry with SITS Sweden for research in different institutions and development of stroke teams. Medical student webinar and a research committee is one of the new one. So finally, the last slide, the big thing this year happened with Dr. Zafar Mirza's and Usman Mushtaq is here who can tell us more about this program. I think this is the same program that Merit has been doing for the past 10 years, over 10 years, how best we can, share our knowledge and cases with Pakistani colleagues and learn from them. It's a two-way. I would emphasize that it's a two-way learning. The Pakistani colleagues, Pakistani doctors, Pakistani medical leaderships, professors, they are not, second to none. And we learn from them. It's just basically coming together on one platform and seeing what we can do better. And so family practice is on the track for that. But I think Yaran Watan program has great potential. And we are already, APPNA Merit has already signing the MOUs with Australia, with UK organizations so that we can come on one platform. So that's our vision, that when we talk to colleagues in Pakistan, we're not coming from different countries outside Pakistan, but with one platform, so that Pakistani leadership, it's easier for them to understand what can we do together. So that's all from me. I thank you, Danish.
Thank you. Let's try to be right on time, and we will try to remind everyone so that they are keeping a track of time and know where they're at. Dr. Shahid, please go ahead and invite Dr. Nahid Usmani for her comments as president.
Thank you. Yeah, I would like to invite our president, Dr. Nahid Usmani. And most of you know, but it gives me a great pleasure that this year, Dr. Nahid Usmani is the president of the main central APPNA. But Nahid Usmani was the person who started Merit about, say, 12, 13 years ago. And I was just her foot soldier at that time, a member of the committee. And she'd done a marvelous job all through the years. Then Dr. Babar Rao is here. He has done great job for Merit. So we are just carrying, me and Dr. Danish Bhatti, just carrying that, baton and carrying it forward. But really the hard work was done by these pioneers. And so it gives me great pleasure to introduce and welcome Dr. Nahid Usmani to please not only tell us about all the family practice, but also welcome the EC members if they are here of APPNA.
Assalamu alaikum, everyone. Danish is being very humble. He has grown APPNA Merit to where it has become the flagship committee for APPNA. I think we all owe him and Danish a lot of gratitude for all that has been accomplished. I would like to recognize Dr. Harun Durrani, Dr. Naseem Shakhani, and Dr. Rizwan Khalid, members of APPNA Central Executive Committee, who are very committed to the transfer of technology and medical education in Pakistan. At this point, I would also like to recognize Dr. Tariq Banuri. When in 2007, I was made the chair of this ad hoc committee that was going to focus on medical education and transfer of technology from Pakistan, I started talking to different people, getting their guidance, and believe me, Dr. Tariq Banuri was one of the original people who conceptualized this whole program, along with Dr. Adil Najam, to sort of figure out how we could create a committee within APPNA that would have sustainability, that would have impact, acceptability in all the teaching institutions in Pakistan. We met many of the vice chancellors, principals of medical schools, CPSP, PMDC, all the stakeholders in Pakistan, starting from students all the way to vice chancellors and higher up. We asked them, what did American physicians needed to do to impact positively in the healthcare delivery in Pakistan. So I'm going to share my screen. I just wanted to do a review of from a family medicine perspective. And I don't have a lot of slides. I have only 3 slides, but we are, the main goal for 2020 was to help Pakistan develop primary care and establish family medicine as a subspecialty in Pakistan. And as Shahid mentioned, we, with the collaboration of Higher Education Commission, Dr. Zafar Mirza, Federal Ministry of Health, and Vice Chancellor of Rawalpindi Medical College, held a very successful conference titled Building Primary Care Capacity, Pakistan's Critical Need. So the conference, at the end of it, we had certain recommendations that we arrived through the Delphi method and input of the various stakeholders that were present in that meeting. So the first recommendation was that family medicine training programs needed to be established nationally across all Pakistani institutions. Second was that we will have to have different tiers of training and certification, though our bias is to have a single CPSP training program. But because we needed to rapidly develop a family medicine specialist training program, we will have to have a 6-month or a year-long training program. So we will have to create different tiers, one for delivering primary care, and second for developing of faculty in primary care, so we could establish the training programs. We needed standardization of coursework and certification across Pakistan. And most importantly, family medicine has to be introduced as an undergraduate specialty for MBBS. It will encourage academic appointments for family medicine specialists and will enhance the medical students emerging from MBBS program with a good handle of what it is to go out and practice primary care. One of the key things was that we needed to incentivize doctors to undertake family medicine training, because all subspecialty training is encouraged in Pakistan, and family medicine is like the default. If you don't get into a CPSP, postgraduate program, that's when you set up your shop and hang your shingle. We wanted to establish collaboration between APPNA and Pakistani institutions for family medicine training design, online coursework, visiting faculty. We were going to give our input to the governmental policies, and we were going to develop alumni family medicine leads. It was clear that Pakistan has a huge shortage of nurses, especially postgraduate nurses. So while a ton of nursing schools have been opened in Pakistan, but they don't have the doctorate or the postgraduate level nursing to train them. We also needed to develop allied health practitioners. These were the recommendations. And then, we visited different medical universities and institutions, and 5 major Pakistani medical universities agreed to join APPNA Merit in the Family Medicine Collaboration. Fatma Jinnah Medical University, Professor Gondal is here, King Edward Medical University, Khyber Medical University, Nishtar Medical University, and Rawalpindi Medical University. So if we are able to develop family medicine programs in these major universities, we will have a very comprehensive start to the program. We are ready to start the pilot in these universities with hopefully their collaboration, input, and agreement. We also met in March with the Prime Minister and the President and various health ministers, both provincial and the federal. And the Prime Minister enthusiastically endorses the Family Medicine Initiative and APPNA's work, and he wanted us to implement the conference recommendation. The President of Pakistan also offered his strong support to Merit Initiative, especially the primary care, and he felt online teaching was the way of the future to bring Pakistan, open up Pakistan to international medical education. We got more concrete with the Punjab Health Minister and discussed about implementation of the family medicine training program within the province. Because at the end of the day, health is a provincial issue. We also met with US Ambassador and had 2 USAID meetings. And since coming back, we have had another USAID meeting, and we met with their implementation programs partners in Pakistan. And USAID wanted to collaborate in the primary care development because they're running some primary care clinics in the KPK province. There were other things that they wanted to help develop: online coursework and graduate nursing education. COVID has clearly derailed some of our timelines, but these were what we wanted to have APPNA deliver for Pakistan, and I'm very eager to hear from our Pakistani collaborators and supporters to see how we can deliver on these goals and aims. That's my presentation. Thank you very much, Danish and Shahid, for giving me a chance to speak.
Thank you, Nahid. That was very enlightening. I think we will keep on moving. I think Dr. Faisal Sultan is here. I don't see in the panel because he was next, but I think we will continue to move on and invite Professor Tariq Banuri, chair of HEC. I had great, working relationship with him. I have great respect for him over the past 2-3 years. Whenever we reached out to him and discussed about various educational support that HEC is doing in Pakistan, especially as it relates to the medical community, he always have been very welcoming, engaged. And so it's my honor to invite Professor Tariq Banuri. Please go ahead.
Thank you, first of all, to Shahid and Danish for inviting me, and also to Nahid, not only for the invitation, but also for the kind words. I remember vividly when Merit was incubated, and I was one of the persons that you talked to about this, and I'm very happy that it has now come of age, as it were. Dear colleagues, before I say a few words about family medicine and about the collaboration that we've had, I do want to reflect on the current situation. The fact that COVID has completely disrupted the world and has the potential of undermining society as we understand it, maybe putting us on a different pathway. It has also made us aware very much of our own mortality. We know people who have contracted the disease. Some near and dear ones have passed away, and it's a it's a tremendous moment of self-reflection. One of the things that it brings forward is our own sense of commitment to be able to accomplish valuable things in the uncertain amount of time that is left to us on this planet. And I see the initiatives that are being taken by our friends and partners from North America as being falling into that category of the contribution that we are jointly making to a mission to make this into a better place. And I really salute you for this. Thank you very much for the work that you're doing. Again, as I was thinking about this, one of the famous texts which allow people to reflect is Albert Camus' wonderful novel, The Plague. Camus, as you know, was a Nobel laureate in literature. The Plague was written in 1947 about a plague that swept the city of Oran in Algeria. And there are a number of things, number of lessons to draw from it. The one that I remember vividly is that the narrator, Dr. Bernard Drew, somebody talks to him that, you know, the only solution is to pray, the only solution is to do this, and the only solution is to do that. And Ryu is very sensitive to the fact that, you know, death is an ever-present reality. He turns to him and he says, the only solution for this plague is decency. The only thing we can do is decency, he says. And the person he's talking to, he says, what does decency mean? And he says, I don't know what it means for you. For me, what it means is to continue to do my job. And I think the innumerable number of doctors, nurses, health practitioners in Pakistan and elsewhere who at great risk to themselves are continuing to do their job are people that we also need to recognize and salute. I think it's a tremendous moment for this to recognize the immense services of this community. The third thing it also has made us realize is that the time, if it had come a long time ago, but the time really is very urgent now, that we need to bring knowledge closer to the people. We need to put the knowledge in the hands of people. And in some sense, the systems we have created, the structures we have created, has not enabled us to move as fast as we needed to. There are a number of gaps. Both Shahid and Nahid have identified two major gaps on which we focused at the conference in March. One of the gaps is family medicine. Bring the knowledge to the people by recognizing the value of the services that are provided by family medicine. It has been a kind of a, placed to the side, less respected, less prominent, less recognized. The time has come to recognize it because it's a critical part of our system. And unless we recognize it, unless we value it, unless we bring it up, it's not going it's going to remain the gap between the knowledge that needs to reach the people and the knowledge that we continue to develop in our laboratories and hospitals. So from our point of view in HEC, we think that that's a fundamentally important missing piece of the puzzle that needs to be put in place. The other element of this that we also recognized at the conference is nursing. And once again, the shortage of nurses in Pakistan is in part because of the fact that this as a whole section, as a whole segment, as a service, as a skill, as a capability, has not received the recognition that it deserves in terms of what the country needs and the valuable services that it performs. And I think it's very important for us to recognize it, to elevate it, to place it on the proper pedestal, to attract people into it, people who are so willing to serve and so willing to commit themselves to the health and care of people. So for both of those, we do, I mean, on the nursing side, we do have educational programs. I think we need to be able to attract larger numbers of people. We need to raise the quality of education by bringing more professionals into the education system. We need to add to the components that we have already by bringing online and hybrid forms of education into the system. And we also need to find ways in which we can benefit from the enormous expertise that we as Pakistanis have in the form of our friends and colleagues who live outside of Pakistan. And so we are looking to work with you to build up a system which can enable us to do all of this. In the similar manner, again, we are very, very keen to develop family medicine as a specialty in collaboration with you, both to start bringing in the expertise that is needed in order to build up those programs, to build up the appropriate curriculums, to recognize the importance of this as a specialty, but then also not to wait until for years and decades before this expertise gets built up, to take advantage of the fact that we have online education, we have hybrid education, and we now have vehicles, mechanisms to be able to benefit from your expertise and to join up with you, to create the systems which would enable us to jumpstart this program. So, colleagues, as far as we are concerned at HEC, we are fully supportive of this program, and we will do all that we need to do at our end to provide the appropriate regulatory and other framework in collaboration with PMDC and with CPSB. Before I conclude, let me just say one other thing, that we've also now introduced major changes in the research program that HEC supports. HEC is perhaps the largest funder of research in Pakistan. We provide significant amount of resources to universities and through universities in collaboration with others. We've set up a major domain of research expertise in the health sciences systems. We are very fortunate to have Dr. Zulfikar Bhutta, who's the chair of the scientific panel on health sciences, and a huge amount of money is going to be is already being allocated for a practical applied research in this area. We've also now started, and we are just about to issue the contracts for research on COVID-related subjects, which are also very much in the health domain, although there's some in the materials and other domains as well. So research is one more area in which we are making significant headway, and we look forward to greater collaboration with our colleagues in North America and in the rest of the world as the research moves forwards, because our funding is meant not only for funding people here, but also to enable them to collaborate with our partners across the world. So ladies and gentlemen, let me just conclude with this. I think we have very important agenda items with us. We are fully supportive of this. And as I said, the COVID situation has reminded us that we don't know how little time we have left on this planet. These are ambitious goals. These are the goals that will change, improve the lives of millions of people. And I hope that all of us are partners in making this transition possible. Thank you very much, Shahid, Naeed, and Danish.
Thank you, Professor Tariq Banuri. I think I do not see, Danish, correct me if I'm wrong, Dr. Faisal Sultan, and I already know that Dr. Zafar Mirza had some family emergency and could not attend. So I will invite his assistant in Yaran Watan program, Usman Mushtaq, for just 2 minutes briefly to tell us about Yaran Watan, because then we'll have to start the panel discussion. And, I'll hand it over to Danish after that. So Usman, are you there? Can you please start and just 2 minutes introduction?
Assalamualaikum. Thank you so much. I think I see Dr. Faisal online. I'm not sure if he's responding or not. I was with both the doctor.
Okay, so
Dr.
after
Faisal.
you, we can talk to Dr. Faisal Sultan.
Right. So, very briefly, Yaran Watan is a collaborative effort between the government of Pakistan and diaspora organization. Dr. Naheed Usmani was a founding member of this initiative, which started early last year, and the entire idea was to facilitate and to make sure that the efforts of diaspora organizations and individuals in health system in Pakistan were ramped up and were streamlined in a way which ensured maximum impact. So Yaran Watan was launched in April, initially because of the situation that we're in, to augment the efforts government is conducting against COVID-19, and given the fact that we're in a situation where international travel is quite restricted, the first major push that Yaran Watan focused on was to link diaspora health professionals to Pakistani institutions through the means of digital health, telehealth, and so forth. So it's an initiative that is it's forming its way. It's forming with time, with the evaluation and feedback that we're receiving from both diaspora organizations and the diaspora health professionals that are engaging. Currently, the platform itself is active and it is expanding. We launched recently the webinar and teletraining series, which APPNA is a founding member of, and ensured that it had or could have a maximum outreach to Pakistani health professionals. So it's a project and initiative that is in evolution, and inshallah, with time, and as we come out of this crisis, we will see more and more of the original goals of the initiative take form. And I will be more than happy to share a short brief to all the participants here.
At the end, yeah, we can. Thank you, Mushtaq. This is. I would like to invite Faisal Sultan, Dr. Faisal Sultan, if they are there, so that he can also represent, Dr. Our health advisor to Prime Minister's point of view and government point of view as well. Dr. Faisal Sultan, are you there? Can you?
I'm there. Yeah, I'm there. Unfortunately, I had to juggle things, so you will see me a little bit darkly. I am being driven, so I'm safe. Yeah, I think it's a bit difficult to speak on someone's behalf, but because we have spoken and discussed this matter before, and we have shared the stage on this very matter. I'd be very brief, but in a nutshell, one of the most important reform initiatives of the government has been to ensure that the primary and secondary health systems are appropriately governed. Most people who reside and work in the developed world are only too aware of the pivotal, really kingpin nature of how primary care ensures continuity, ensures quality of care, and ensures actual provision of care. Unfortunately, and this is to some extent a common theme across developing countries, that a lot of the resources and manpower get sucked into more narrow fields. And so this is often at the cost of and to the detriment of primary care medicine, as well as Professor Banuri mentioned about nursing and so on. So one of the ideas is to ensure that there is devolution of and separate governance of the primary healthcare system, which includes the districts and the tehsils and so on. The Rural Health Act, as envisioned, and it's taken a little back burner because of the crises and the crisis that we are following and that we are facing. But nevertheless, it's going to be on track, inshallah, soon. And the idea is that we have appropriate and local and contextual governance of the primary care system across the country. Some key elements of that relate to the fact that one, it has to be detached from the operational command, the operational oversight of the health secretariat necessarily, but of course remaining still in the strategic ambit of what the province or the national targets are in terms of primary care, immunization, and other vertical programs. So it's the outlines are in place. biggest challenge I see beyond the actual legislation is to find appropriate and committed people who are disinterested in any personal interest way, but yet entirely committed to the idea of oversight. This is one of the challenges that we have seen while trying to recruit people in this pro bono role for governing boards for the medical teaching institutes, for example, in the KPK, as well as for other complex and difficult tasks which require time and really at times are seen as being thankless. So that is the briefest version of the government's point of view. And I think the other thing that Dr. Zafar has put together, and I think Dr. Usman Mushtaq also referred to, was the idea of engaging our fantastic diaspora through this Yaran Watan program to include people. Now, this perhaps in many ways was the toughest time to put something like this in place. But nevertheless, I think the first steps have been taken. And I think as travel and other things ease up a little bit, we would be able to benefit from expertise that resides in Pakistanis outside Pakistan. So I'll be very brief and short here and stop here.
Thank you, Professor Faisal Sultan. Always a pleasure. I know you've been very proactive also whenever I met you or we, from APPNA Merit, any educational collaboration, you were always welcoming and engaged. Thank you very much.
Thank you, sir.
So with that, I think we are running over the first half an hour into the panel discussion, and I wanted to hand over to my co-chair, Dr. Danish Bhatti, to give panelists. Now we have to shorten the time, but I would like to again welcome EC. In addition to Dr. Nahid Usmani, we have APPNA Executive Council present here, Dr. Rizwan Khalid, the President-elect, Dr. Naseem Shekhani, immediate past President, Dr. Harun Durrani, Secretary of APPNA, and Arshad Rehan is the Treasurer of APPNA. So all APPNA ECs present, and I'm very honored to have their presence. So Danish, over to you if you also want to in the panel take President-elect's view on family practice during that panel discussion. Thank you.
Thank you so much, Shahid. So in the next half hour or so, what I'm hoping to do is to have some ideas on what's developing in primary care and family medicine already in Pakistan. So we have representation from many of the illustrious institutions in Pakistan with their top leaders present to give us a summary of what's going on already on the ground and what they think are the missing gaps that especially in the context of where these Pakistani diaspora organizations can help. And then we have a representation of a few other diaspora organizations and experts scattered from around the world and globe that will add to this discussion by providing feedback on what they think can be done or what they think can be added to give some ideas to the luminaries present. And then we will try to wrap it up as fast as we can. I will request everyone to try to keep it under 3 minutes, but definitely try not to go over 5 minutes if possible. That will allow us to have some time, hopefully, to have some questions or pointed discussion on things that are very useful and near and dear to everyone's heart. To set the tone of this discussion, what I thought I will do was to quickly summarize the few points that came out of the Family Medicine Conference that we had in March 2020 in partnership with HEC and the Federal Health Ministry, so that we have an idea of where the conversation should start, what we have already heard from everyone, what were the key points that were stressed by everyone. So rather than going through any presentation, I was just wanted to quickly point out or read some of those points from my notes and summaries here. What we did in the March conference was to divide the whole conference into 6 different sessions or themes or topics. So the first one was family medicine policy framework and career planning. And the points that were highlighted by everyone was to recognize family medicine as a specialty and a physician trained in family medicine as a medical specialist, having a central governing body, having financial and economic incentives for practicing family medicine, and having those incentives tied with the training in family medicine. The second theme that we talked about was family medicine curriculum and training. And the points that came out of that from discussion to everyone included having a minimum necessary postgraduate training before getting that kind of a cadre of family medicine specialist. Developing faculty and faculty development programs in institutions to have those training and curriculums done. Having a standardized common training program was something that was recognized by most parties as very important, to have a one uniform curriculum, minimum curriculum that should be implemented by all the institutions and then built on top of it. And then, of course, as Dr. Usmani mentioned, starting in undergraduate level and improving the quality of training. The third session was healthcare systems and role of technology. And we talked about developing a national electronic health record system policy and an office of national coordinator on healthcare technology, and setting some minimum standards such as for prescription using electronic health records, and then using telemedicine for improving access. The fourth session was on preventive care in family medicine. And the points that came out included primary prevention to be an integral part of family medicine, a multidisciplinary team model for providing resources like community nurse educators, nutritionists, dietitian, therapists, including physical, speech therapists, occupational therapists, to provide a comprehensive care in a family medicine environment or primary care. And then a comprehensive program of minimum preventive screening with a national standard. The fifth session was on public-private partnership, and we talked about engagement of the non-practicing female physician workforce in Pakistan, quality of practice indicators to be standardized so that a primary care center can be evaluated and assessed for quality of care they're providing, and then use of third-party fund account holders like escrow accounts for some of reimbursement or exchange of money between private partnership and public programs. And then the sixth session was on strengthening nursing care, and we talked about various roles of nurses within a primary care setting, including role of midwife, nurse practitioners or advanced practice nurses, and other pathways for nurses to strengthen the primary care and family medicine in Pakistan. So with that summary, before I start with the panelists, I want to take this opportunity and invite our president-elect, Dr. Rizwan Khalid, to give an idea of his view of primary care and his role, his view of merit, especially because he'll be leading a lot of these efforts next year. So Dr. Rizwan, please go ahead.
Thank you, Dr. Danish Bhatti and Dr. Shahid Rafiq. Assalamu alaikum, all panelists, attendees from Pakistan and from across the globe, representation from the UK as well. And there's many people that I know, Dr. Junaid Razak, Dr. Professor Zulfikar Bhutta, Vice Chancellors, Principals, Dr. Faisal Sultan. So my assalamu alaikum and warm welcome to all of you on this symposium. I will certainly at this point in time, I know I have to give closing remarks in the end. So I will at this point in time only focus on the question that has been asked, which is about family medicine and how we're going to move forward. I think there is no better need if we are going to decide about resources in Pakistan. There is no better need than for preventative and primary care. That is, I certainly believe that the biggest bang for your buck is if you provide, preventative care. When you have kids dying from diarrhea and dehydration and malnutrition, you really cannot even think of getting an ECMO machine for a cardiac surgery or a thoracic program. We have to decide on the needs of our country based on what the actual disease burden is. With that, so I believe that family medicine are certainly the front line in providing healthcare in Pakistan. And I'm supportive of the program and believe that all stakeholders, APPNA Merit and APPNA, we are just here to facilitate. We will provide and help all the family medicine stakeholders in Pakistan, especially the commission that was formed of various family medicine leaders. Dr. Nasir Shah is here from University of Health Sciences. I had a long discussion with him in Lahore in February of this year. So certainly everything that we do will involve all the stakeholders of universities and family medicine head of departments in Pakistan. And we are here to facilitate and help out as much as possible. I appreciate the time that has been given to me. Thank you, Dr. Danish Bhatti and Dr. Shahid Rafiq. Over to you.
Thank you so much, Dr. Rizwan, President-elect 2021 for APPNA. Let me start the discussion by inviting for a national view and perspective, Professor Dr. Gohar Wajid, who is a representative of WHO for our region and have really good ideas about family medicine development. Professor Wajid, please go ahead.
Thank you so much, Dr. Danish and APPNA Merit team for providing me this opportunity and organizing this very auspicious webinar on family medicine prospects in Pakistan. Since the time is very limited, it's just 2-3 minutes, I would emphasize, and the issues are multifaceted, and I would like to touch only one facet of the issue, that is the training of the existing over 100,000 general practitioners who have been trained on the traditional general practice system, and we need to orientate them, provide them some kind of introduction to the principles and practice of family medicine. And many of you are aware that the WHO Eastern Mediterranean Regional Office that I am representing and where I work, we initially prepared a 6-month program in family medicine. But then on the request of the universities from Pakistan and family medicine stakeholders, we realized that the program needs to be upgraded to 1 year. The program was upgraded to 1 year. It's a blended learning program that I have been advocating in Pakistan and in the whole region, because the program is for the whole EMRO region, and we have been advocating the program. I am already in touch with 5 or 6 universities. This platform, the program is open to all universities in Pakistan. They are most welcome to collaborate with WHO office. We would provide them the program. The whole online version is ready. The curriculum is ready. We are most willing to provide them all the facilities, even the training at the expense of the WHO, where the WHO experts would be coming to Pakistan to the particular university. And we are most willing to share our expertise to develop and implement that program of 1 year. Specifically, it's a bridging program to provide orientation to GPs. At the same time, we are also in the process of now developing a program for introducing principles and practice of family medicine to family medicine teams. I would end it here and re-emphasize that all universities must participate in this effort, because this is a national cause where the goals set up for universal health coverage and sustainable development goals, to which Pakistan is international signatory, cannot be achieved without the participation of very essential stakeholders from Pakistan. Thank you so much. I'm dropping my email in the chat box. If any one of you wishes to get more information, you are most welcome. Thank you so much once again.
Thank you so much, Professor Wajid. It's a pleasure. So next, I want to invite someone really special to my heart, Professor Dr. Khalid Masood Gondal, Tamgha Imtiaz, Vice Chancellor of my alma mater, King Edward Medical University. And I remember him very fondly from the days when I was a medical student and he was teaching us in our surgery rotations. He has always been very kind, benevolent, very gracious and graceful. So I'm so proud to have him as Vice Chancellor for King Edward. Professor Gondal, please go ahead.
Thank you very much, Dr. Danish, for so very kind words for me. In fact, in January, Professor Naheed and myself discussed and we are planning to welcome you all. We were planning to welcome you all on 20th December, and King Edward has the honor to be the host of your international symposium. But COVID has disturbed everything. Let us see how the things go on. Now, as far as family medicine is concerned, I think we have touched a very important specialty. Of course, they are the backbone of medical profession, and they need the special attention in that way. And I'm very grateful to the APPNA Merit for their support in the development of this very important specialty, which is being ignored in Pakistan. Now, as far as King Edward Medical University is concerned, by the grace of Allah Almighty, this university is recognized for the postgraduate program in family medicine. Our head of community medicine is PhD, she's FCPS, she's MPhil, and we are having the PhD program, the fellowship program, and the master's program. And with the collaboration with the APPNA and now Gohar Wajid Sahib has extended the support. With this support, inshallah, we will strengthen our program. Already we are having the regular courses for the family physician in Pakistan through this King Edward Medical University. And then somebody mentioned about the training of the nurses and the postgraduate courses, and you'll be happy to know the King Edward Medical University is having the College of Nurses, and we are having the master course for the nurses, and inshallah we will be leading to the PhD course for these nurses. And about the allied health practitioner and professional, that was also discussed. We are having, I think, over 10 program for allied health professionals, College of Preventive Ophthalmology and College of Physiotherapy, they are there. And the King Edward Medical University is also the first public sector university in the province of Punjab, where we have got the recognized program in emergency medicine. I remain in touch with Junaid Razak and Taj Hassan, and we are going to strengthen that program too. You mentioned about the telemedicine, and during this COVID-19, the King Edward Medical University has established a full-fledged department of telemedicine, which will be a permanent feature. We are having the tele-outdoor, tele-psychiatric test, and COVID-19 24/7. Now coming back again to the family medicine, beside King Edward Medical University, I have been representing College of Physicians in Pakistan, and you mentioned about Nasir Shah. He has been a big support. Currently, the college has produced over 1,000 masters like MCPS in the family medicine, and college is having the fellowship program in family medicine too. But I think with this support and with the collaborative efforts, the family medicine program will be strengthened in Pakistan. And I could see today, East and West, they are on one globe. I could see Majid Gondal from Australia, could see Nahid Usmani and Danish Bhatti from US. So with this global support, inshallah, you will see a definite and substantial change in the development of specialty of family medicine. Thank you very much, Danish Bhatti Saab and everybody on the screen. And I think great salam from King Edward Medical University.
Thank you so much, sir. Thank you for being here and your kind words. Let me move on to the Vice Chancellor for Khyber Medical University, Professor Arshad Javed. We have been collaborating with various programs with KMU from APPNA Merit, and I've been thoroughly impressed by the quality of programs, by the quality of the team at Khyber Medical University, and I'm looking forward to great work at Khyber. So Professor Arshad Javed, please go ahead and unmute yourself.
Assalamu alaikum. Thank you very much for inviting me, and I really enjoyed the talks that I've heard. Yes, today's meeting, the emphasis on family medicine and also quality of nursing education and standard of nursing practice in Pakistan was discussed, and I absolutely agree with the speakers about the need for improving on these two areas, which are very important. The family medicine, I very much appreciate the initiative by APPNA. I did attend a conference in Rawalpindi Medical University. I appreciate the APPNA contributing towards improving the family medicine and encouraging and the family medicine practice and education in Pakistan. A few years ago, under the WHO initiative, Pakistan was given a target, especially the universities of Pakistan, to start some diploma program in family medicine, so that because for comprehensive care throughout the country, we need to have at least 66,000 general practitioners. As we know, we hardly had any program in Pakistan. So with the help of Professor Gaur Wajid, who I just spoke before me, we did work on it, and within a span of 2 years, we were able to get the Department of Family Medicine, Faculty of Family Medicine from UK, and we have started the diploma program. The first batch has already graduated, and now we are in the mid of the second batch. We are actually working in collaboration with provincial government. We have targeted our first batches on the medical officers who are already working in BHUs to introduce this family practice model. So we are moving, and I can also see that many other medical universities in Pakistan are also following this program, and hopefully there will be mass production of family practitioners in the country, which is direly needed, to be honest. As already alluded to, that we have been concentrating on producing specialists in various fields, like College of Physician Surgeon, but this family medicine was lacking. As far as nursing is concerned, yes, there has been a fundamental change in the nursing education in the last 2-3 years. Perhaps you would know that nursing was training was after secondary school metric. They used to train for 3 years in the hospital, and they would become registered nurses. And that is the reason this was very substandard training, and that was the reason that we never saw a Pakistani nurse in any of the foreign countries. But in the last 3 years ago, it was decided by Pakistan Nursing Council that there will be no more RN nursing. There will be BS nursing, which is after FSC. There will be BS training for 4 years, which also include a research component. And in KP, Khyber Medical University is spearheading this program. We have got a School of Nursing. We not only doing master's bachelor program, but also master, and PhD is going to be started. So from now on in Pakistan, there will be no more RN nursing. So with the passage of time, we will see that with better qualified nurses throughout the country, will be producing better nurses, and this will obviously improve the nursing standard. So we had a gap in education of nursing in the past, and the qualified nurses, the BS nursing, are also almost equivalent to doctors as far as their pay and grades are concerned. So the point that was mentioned, that nursing was in the past not given that much recognition as doctors, so they are coming closer. So in these two areas, I think Pakistan is moving on, and I very much appreciate the effort of APPNA that they're also chipping in and helping Pakistan. So thank you very much indeed.
Thank you so much. It's so heartening to see how much work is going on in Pakistan already. Let me move on to someone who is the strongest supporter of APPNA Merit, without any doubt. Vice Chancellor of Rawalpindi Medical University, Professor Muhammad Umar. We are so grateful and thankful for him hosting our APPNA Merit Family Medicine Conference at his beautiful institution. The arrangements were spotless. Everything was done so amazing, so wonderfully. It could not have been a better conference. Thank you so much for being such a wonderful host and for hosting us, Professor Umar. Please go ahead.
Bismillah ar-Rahman ar-Rahim. Thank you very much, Danish, and rest of the team for inviting me. My experience regarding all these programs. Let me thank first the leadership of APPNA and APPNA Merit, who were so kind to select the Rawalpindi Medical University as the hub of their activities. Although Rawalpindi Medical University is a very naive university of 3-year-olds, but it has become the national and international hub for all the academic activities. Let me thank also to the chairman HEC, who basically in a very short span of time allowed the Rawalpindi Medical University and other two universities the status of degree awarding. So this was the last difficulty we have to start our residency program in family medicine. So talking about the family medicine, Rawalpindi Medical University already have completed two certificate course. This encompass about 60 general practitioners who got this certificate course from the Rawalpindi Medical University. So this was the first achievement of this new university. We already approved our diploma curriculum from our academic council and syndicates, and we were just waiting from the approval of HEC, and Dr. Tariq was so kind by managing this approval, and inshallah, as soon as the COVID is over, the Rawalpindi Medical University possibly will become the one of the pioneer university to start the diploma course in family medicine. Regarding the 4-year residency program, which is at the pattern of Accreditation Council for Graduate Medical Education, on the lines of WHO, as Dr. Gaur has mentioned, and PMDC, the Rawalpindi Medical University will be again, inshallah, be the first university to start the residency program in family medicine. I think maybe the start of next year. Then coming to the, nursing, we already have upgraded our school to the nursing college, and we have, just starting our master program, inshallah, next year. Allied Health Sciences, we have 500 students of Allied Health Sciences, and they are doing the PhD also. I think I really appreciate the effort of the APPNA first time by this very pushy team who started from the policy framework, involved the government at the highest level of prime minister levels, policymakers like Dr. Faisal Sultan, and then the federal and provincial government and the leadership in the medical education in the form of vice chancellors of the university. And the merit, I think Dr. Shahid Rafiq doesn't allow us to speak, to even sleep. I was with him early morning in another webinar, and now for sleeping time in Pakistan, we are on this symposium. I'm really grateful the support, the APPNA merit programs, the Higher Education Commission, and the government and other colleagues, the Vice Chancellor, which they are extending to the Rawalpindi Medical University to establish the teaching training program in family medicine, particularly the university residency program, which will be the first of its kind in Pakistan, and nursing program, as well as the allied health sciences specialist. I thank you once again, and I need your cooperation and guidance and support to move further in all this activity with the APPNA and APPNA merit. Thank you very much indeed.
Thank you so much, Professor Umar. So next I will go on to the Vice Chancellor of Jinnah Sindh Medical University, Professor Tariq Rafiq. GSMU has been doing a lot of work in family medicine, and we had a strong participation from them in our family medicine conference, and looking forward to it. Professor Tariq, please go ahead.
Thank you, Danish. Thank you for giving me this opportunity. I'm really grateful to you, Danish, and to to Nahid, who is the president of the APPNA, and Mr. Dr. Shahid for organizing this webinar, because this is a very important topic that we are talking about. Family medicine, importance of it is being realized recently, because previously it has been neglected a lot. I remember Dr. Aziz Tank, who was one of the pioneers who started the family medicine program in Pakistan. And the university has started a family medicine program 3 years back. We have got a very strong faculty. Mary Andres, who is a fellow, is the professor of the department, along with 2 other fellows that we have. We have an outreach program. The family medicine people are not only working within the city, we are moving out to other areas. Whether we have taken over some of the basic health units from the government of Sindh, which we have adopted ourselves, which we are working upon. We have got a very strong program for the general practitioners. There's a diploma program. We give them a certificate course of 6 weeks when they join us. This will be an online program that we have started. As Mr. Gaur Wajid has said, that we are working with the WHO along with Mr. Gaur Wajid to start a program for the diploma that we are going to do it with the WHO. So family medicine is basically one of those things that we have to have started much earlier. No nation can have a strong healthcare system unless the family medicine is established. Unfortunately, this was not something which was being appreciated 10 or 15 years back. But as you have seen that every university has started a family medicine program. And fortunately, with the help of APPNA that we have from you, we can have a transfer of technology to learn from your experience to improve our programs. And the program that you had in March, similar programs would be of great help. Due to Corona and the difficulties being traveling, we think such webinars that we have organized today will be of great help in improving the status and the structure of our program that we have here. We would also like to see the government spending more on primary health care and on the preventive medicine, because the pressure that we see on the tertiary healthcare system is basically because the primary healthcare system is not that strong to take the load, and that is why the patients are coming even from very far-flung areas to larger cities, because even a small disease could not be treated. As far as the nursing is concerned, yes, nursing is in a very is one of those things which are being neglected for a very long time. And as very rightly said by Arshad Javed, that nursing program, which was giving a diploma to RN nursing, has now been completely changed by the nursing council, and now they are giving a bachelor's degree after an FSc. Girls goes into it. This has given a prestige to the qualification, and this prestige has attracted more girls into it. Our college, university, though not very old, we have started a college of nursing. We are running a BSN program. At the same time, we have started a master's program also. And there are very few PhD nurses available in the country, but fortunately we have two of them, and that is why we are running a master's program also. In the years to come, I think that the nursing program, the family medicine, they are going to come of age. They are going to improve a lot. And we need a collaboration with APPNA, with all the international agencies like WHO and others, to bring an improvement in our programs. We look forward for this, and I'm really thankful to all of you for providing us this opportunity to be with you, to learn from you and all the learned speakers who have given their views. And I think in the time to come and in further webinars will be an addition to all what we have done today. Thank you once again, Danish, and I'm really grateful to all of you for organizing this webinar. Thank you very much.
Thank you so much, sir, for attending and sharing all the information. Let me go on to the National Medical University. I want to mention that the Vice Chancellor, Professor Mustafa Kamal, have been really a strong supporter. He joined our Family Practice Symposium, and even though he is sick with the viral infection, he has still been very reachable and cooperative with us. We have the pleasure of the Principal of National Medical College, Professor Dr. Iftikhar Hussain Khan, representing the National here. So let me go on to Dr. Iftikhar. Please go ahead.
Thank you very much. Assalamu alaikum, everybody. And I thank all of you for giving us the opportunity, the National Medical University. And I'm representing Professor Pasha while he is not well. I asked you to pray for him as well for a speedy recovery. I thank APPNA as well, APPNA MERIT, for organizing and providing a very robust platform for all this activity. We are one of the first 5 universities who have sort of consented and joined our hands to ensure that a very useful program would be initiated at National Medical University, both in terms of family medicine as well as the nursing. And obviously we are planning to launch programs to target both those family physicians who are already practicing, to give them some sort of a short rapid entry course into the structured family medicine program, so that because they are actually holding the fort at the moment, whatever their training was. We have to sort of provide them with some sort of a framework and some sort of a certification that would be a ground to go ahead on the family medicine front. And in addition, obviously, to formulate new program in collaboration with other arts sister universities, especially King Edward and Rawalpindi Medical College and the other universities, to formulate joint programs so that we are sort of homogeneously running a curriculum and a program which suits our country best. On the nursing side, as everybody has mentioned, the RN program has been sort of scrapped now, and it's only bachelor, the graduate program, and the post-graduation that Nishta is already pursuing. And I'm once again grateful giving us opportunity for that, and ensure that the strongest support will always be available from Nishta Medical University. Thank you.
Thank you so much. Let me move on to one of the top leader in a strong dynamic moving force in the nursing development, Professor Rafa Jan. We had the pleasure of connecting with her for the Family Medicine Conference in March. But then since then, the collaboration have really mushroomed and so much is going on. We are moving on to developing a large group of APPNA MERIT nursing chapter with many dozens of nursing leadership from US, from Pakistani diaspora, and from Pakistan under the coordination of Professor Rafa Jan. We're also working on starting a merit webinar specifically targeted for nursing and for nurses audience under her leadership and collaboration. And then Professor Rafa is also a dynamic force in helping us develop a specific skill course on critical care nursing through the APPNA MERIT platform. So it's a really great pleasure to hear from Professor Rafa Jan. Professor Rafa, please go ahead.
Thank you. Thank you so much. You all made my day. Can you hear me?
Yes, yes, please.
Sorry, I'm in Chitral. So you all made my day today hearing nursing. That's so great. And I'm really thank you to APPNA MERIT and APPNA EC that they have approved our request. We are working with APPNA MERIT on 2 tiers. One is actually working on the specialty of the nurses program. And the first one we started critical care. So those nurses from US and Canada and other places of the world who are expert in critical care, they're developing the course and they are going to offer this course. Simultaneously, we are developing one other paper to bring it in Pakistan, especially to introduce the structure of nursing specialty and nurse practitioner. While I'm still a little skeptical about this internet connectivity, there are some little bit hiccups or obstacles, which if Tariq Banuri Saab with APPNA MERIT 2 co-chair, if you gave me some time, I would really like to discuss with you some of those things which can become very easily facilitator to advance the nursing profession. I am so happy and how in whatever way we can help, and I'm so glad that so many vice chancellors today are supporting for nurses, and inshallah when we are going to bring program in the operation, your cooperation will be very, very helpful for us. Once again, I'm extremely thankful to Dr. Danish, Dr. Shahid, Dr. Noor Mahal, and Dr. Nahed. Great collaboration, and inshallah that will bring advancement in nursing profession. Thank you so much.
Thank you so much, Professor Rafat, and for being such a leader in nursing development in Pakistan. And to round up the discussion from the Pakistan side, it gives me a great pleasure to invite a really good friend and truly a leader in development of family medicine in Pakistan, Professor Nasir Shah. Professor Nasir Shah have been extremely dynamic, doing so much in education, and so many people have reached out to me to let me know how great of a teacher and educator Professor Nasir is. So I have a huge respect for him, being personally a strong educator and interested in education. So I'm looking forward to hearing from you, Professor Nasir. Please go ahead.
Bismillahirrahmanirrahim. Thank you, Dr. Danish, for your kind words. I'm really thankful to APPNA MERIT for organizing this symposium, and I would like to congratulate you for bringing almost the entire leadership of family medicine or the health system into one webinar, except 2 parties, who I don't call them stakeholders, but I call them stakeholders. Stakeholder one is Pakistan Medical and Dental Council, um, the council has the stick. Unless we get the council on track, our efforts may not be that fruitful. And the other stakeholder is the government, so who has to create paid posts for the PG training. So since I have 3 minutes, I will try to focus on a few points. Number one, with due respect to all the members, I think the world has passed beyond a point where we have to prove the importance of family medicine. Family medicine importance is proven now. Its role in health system is proven, and there are other facts on our face in Pakistan. Like we know, our family physicians are not trained. We all know that we have shortage of faculty. We all know the training programs are lacking. So these are the things, and I would like to focus that we should all be now, from now onwards, thinking on practical steps how to promote family medicine. Just highlighting few of them, like on Pakistan Medical and Dental Council side, the council said that family medicine would be made mandatory. Now let's focus on Pakistan Medical and Dental Council to implement its own notification. Like role of College of Physician and Surgeon, I'm really thankful to Professor Khalid Masood Gondar. He has been big supporter of family medicine. We all owe to him. He patronized family medicine, and the big boom of MCPS family medicine was under his leadership. He supported throughout Pakistan. He rendered all the offices of CPSP available to us. Thank you, sir. So now we have a pool of family physicians with MCPS. If CPSP allows them, maybe 50 or 100 of them, to enter into fellowship programs, we can have a good quality of fellows who are experienced, who will stay in Pakistan. So like these steps, like in universities, we have all the universities here, Jinnah Singh, all the universities should at least announce uh, positions for faculty. So people from abroad can come in, they can join, they can start their own department. So another thing, like Dr. Gohar mentioned, if we all align our efforts with the Sustainable Development Goals of WHO till 2030, so we can have concerted efforts, APPNA, the PMDC, college, the federal ministry, and to achieve our goals by 2030. And in this 10 years period, we can be flexible, we can accommodate new ideas just to exponentially increase the number of doctors, both on faculty side, as Professor Nahid Usmani said, faculty and the practitioners. Um, and it is a collective effort. So one last point that I would like to add in the presentation, two universities were missing in the university that consented to join APPNA. I think one of them is University of Health Sciences, and the other was Jinnah Singh Medical. So I think no university will object to it. We just call them, everybody would like to join APPNA efforts for promotion of family medicine. Thank you once again. Congratulations to you, APPNA.
Thank you so much, Professor Nasir, and definitely we'll follow your advice and work on our deficiencies. It's always a work in progress. So next, I have few leaders from various parts of the world in family medicine in our Pakistani diaspora organization, and I will invite them one by one to get their input, feedback, suggestions, and ways we can be useful. Let me start with Professor Mahmood Adil. Professor Mahmood Adil is Professor of Health Intelligence and Service Effectiveness at University of Glasgow and visiting Professor of International Health at as well as he works as a lead for clinical data and intelligence, and among many hats that he wears. He has postgraduate education from Howard Kennedy School, Institute of Healthcare Improvement, Yale School of Public Health, is thoroughly trained and a true leader in his field. Professor Mahmood, it's a pleasure to have you here. Please go ahead.
Thank you, Danish, and Assalamu alaikum. So I'm calling from Edinburgh now. So I'm medical director for NHS National Services Scotland and medical director for Public Health Scotland. That might be more relevant in relation to COVID. So I would like to talk with a couple of basic things first. We are using term family medicine and primary care. So it is very important for all of us. We need to be very clear on those two terms. The family medicine is a specialty which all the elegant colleagues already spoken about. So it needs some competencies and some skills. So we can develop the workforce which is based on family medicine. But primary care is a system. So if we have got the best trained family physicians, but we don't have the system in Pakistan, we won't be able to achieve that outcome. And vice versa, if we can have the best primary care system, but we do not have the right skilled workforce, which is beyond doctors, then we won't be able to achieve the same goal for our 220 million population in Pakistan. So because UK may be one of the pioneer in primary healthcare systems, so that is my angle for the next maybe another 30 seconds. So it is very important that we should put that much emphasis on the primary care system as well. So I have already spoken with Scottish government, so I lead, so I work very closely with the government. So we are very happy to help Pakistan in order to develop their primary care system. I think Professor Banuri already mentioned about the research. So there are three elements we need to be thinking when it comes about diaspora who can help Pakistan. First is, of course, the family physician and the training, which I think many people are helping. Royal College of Physicians, so Royal College of General Practitioner already conducting exam in Pakistan. So we need to be thinking how best we can align the UK version over there. Second, about the training, that how the primary care system run. We are very happy to take the family physician or general practitioner from Pakistan, bring them to Scotland, they can see our primary care system and they can take their knowledge back. And the third thing about research, it is very important that we should have a very clear emphasis on research. And I think on that note, I'm very happy that on behalf of my two universities, I'm very happy to offer that. Thank you.
Thank you so much. Let me move on to Professor Greg Reglo. Professor Reglo has actually worked in primary care and family medicine in Pakistan and has done quite a bit of research and work there and has known all the leaders over there. So it gives me great pleasure to have Dr. Reglo's experience. Professor Greg, please go ahead.
Good morning here, evening there, and salam alaikum, colleagues. It's great to be a part of this discussion, and thank you very much for the opportunity. I just am very impressed with the level of conversation, and I realize how much expertise there is in Pakistan and among Pakistanis abroad. And my message would be to take that and organize it and collaborate across those spheres, because I think there's so much good work going on that if there's collaboration and making the baselining curricula and making sure that we are covering the areas that we need to, that's going to be very important, as well as Dr. Nasir Shah mentioned, the platform and the governmental incentivization of the family physicians and the other primary care specialties. We need to make sure that there's a place for our graduates and for the 100,000 GPs to practice in a sustainable manner. I thank you all for all the great work you're doing, and I wish you all the best.
Thank you so much, Professor Reglo. We're looking forward to your help and collaboration in future. Let me move on to one of the diaspora organization from Pakistan. It's the Association of Pakistani Physicians in Australia, AP. And I have the pleasure of having Dr. Majid Gondal representing the organization. Dr. Majid, please go ahead.
Thank you very much, Dr. Bhatti, and thank you leadership of APPNA Merit team and Chair Dr. Shahid Rafiq to organize such a key event to strengthen foundation for family medicine in Pakistan. As the president of Australian Association of Pakistani Professionals, I recognize the good work done by APPNA Merit and APPNA team led by APPNA team led by Dr. Amar Barni in UK. We look forward to work with these organizations and international diaspora of Pakistani family physicians. Our goal is to support the good work being done in the field of family medicine in Pakistan. We are confident that the present health leadership team in Pakistan, which is headed by Dr. Zafar Mirza, will establish a health system based on principles of primary health care. Now, I would like to invite Chair of AP, Dr. Yusuf Harun Ahmed. He will actually speak more about the work done by AP in collaboration to establish family medicine in Pakistan. So I would like to invite Dr. Yusuf Harun Ahmed.
Thank you, Majid, and Assalamu alaikum, everyone. Thank you for this opportunity by the APPNA Merit team to bring together such an eminent and well-recognized Pakistani and international health leaders. The COVID pandemic has challenged many world-class healthcare systems and countries, including Australia, and we are dealing with immediate needs of our communities. But at the same time, it is imperative to look beyond the waves of COVID-19. The next waves of physical, psychological, and social health issues will require investment in a strong multidisciplinary primary healthcare system, which can provide a first line of defense as well as long-term health and safety of the communities. There is no doubt that a stronger primary healthcare system is most effective and best investment for the health of individuals and communities. So as the Australian Association of Pakistani Professionals, we are following a structured approach towards family medicine support in Pakistan. And I'll just provide a very brief overview today about this approach. We have provided a white paper regarding this strategy and provided a summary to the Yaran Watan as well. And we're happy to share further details with all our collaborators in Pakistan as well as rest of the world. And basically our strategy brings together key elements and stakeholders in a workable framework. Over the last few years, we had several engagements with key stakeholders. And I would like to especially acknowledge the work being done by the College of Physicians and Surgeons, Professor Zafar Chaudhry, Professor Khalid Masood Gondal, Professor Shoaib Shafi, as well as already mentioned, Professor Nasir Shah and his family physician colleagues in Pakistan. Their work already done has informed part of our strategy. And these 5 elements, which I provided you in form a single slide, is really to have a nationally consistent qualification and training framework. And many of you have already mentioned many elements of this framework, and it's good to see that many institutions are providing now formal training for family medicine in Pakistan. Second is to recognize, register, and accreditation family physicians. And I think Professor Nasir Shah has emphasized the need for a positive change in Pakistan to move forward with this pathway. Third element, which is also very important, is the industrial framework, which is really more about a structured system of remuneration and employment of family physician in Pakistan to support a system which can establish an important aspect of primary healthcare system. Jurisdictional framework is also very important, including federal, provincial, and district level health systems. And lastly, of course, data and evaluation. And this is in order to determine relevant national data analysis and evidence to inform the evaluation of family medicine and to support family medicine workforce and health services planning more generally, as well as to provide rigorous evidence base to measure impact of family medicine in Pakistan. Our aim as from Australian initiative is to bring different experts which can support these 5 elements of the framework in Pakistan while the essential work is being done in Pakistan. As part of this efforts, last year we had a formal MOU between Royal Australian College of General Practitioners and College of Physician and Surgeon Pakistan. This is in order to support and strengthen the training and education of family physician in Pakistan, and as well as develop partnership with RSAGP to have a sandwich training program in Australia. And we are making some significant progress in this regard. We also brought together the global leaders of family medicine faculties and colleges to meet with the Pakistani delegates. And we had quite a useful discussions and in fact support from many faculties to help and support the efforts in Pakistan to develop family medicine in Pakistan. At the same time, we are also working with through the Pakistan High Commission in the workforce market for not just the doctors, but allied health, paramedics, nurses, and dentists. But more importantly, to strengthen the education and training in Pakistan to train world-class multidisciplinary professionals. And we are planning a next meeting within next couple of weeks with leadership of different allied health, paramedics, and nursing institutes in Pakistan to have a formal established pathway as well as partnership in Australia to support these efforts. We look forward to work with the leadership in Pakistan, and last year in our meeting with the Special Advisor to Prime Minister, we advocated for appointment of a national task force with relevant experts and stakeholders in order to develop, plan, and implement a national strategy for primary health care with specific focus on family medicine in Pakistan. And we also look forward to work collaboratively with our sister organizations like APPNA MERIT in USA and APPNA in UK and Europe to strengthen the efforts of our family physician colleagues and health leaders in Pakistan. We'll be very happy to provide the details of our white paper to any colleagues as well as through Yaran Watan initiative. Thank you very much.
Thank you so much. These are great initiatives, and thank you so much for organizing the collaboration between the three diaspora organizations. And we are so glad that we're doing this. And that gives me the segue to invite Dr. Amir Barni, President of APPNA, the Pakistani Diaspora Organization in UK. Dr. Amir, please go ahead.
Assalamu alaikum, everybody. Good evening and good afternoon. Thank you, Dr. Bhatti. Thank you, APPNA MERIT, the APPNA leadership, Professor Naid Usmani, and my other colleagues from America across the pond, across Pakistan and elsewhere in Australia. So it's a pleasure to be here, and thank you again for the invitation. I've been intently listening to all these fantastic discussions. It is very heartening to see what's happening already on the ground in Pakistan, and I just cannot laud enough the efforts being undertaken by the various vice chancellors, the organizations, the government of Pakistan, and the institutions there. It is just fantastic work. And it makes our job slightly easier as diasporas across the world to come in and join the systems and start making a change from within the systems, I believe. So while I was looking, I was making some notes, and I really came up with a few points, really, maybe 4 points. And I think we need to think of the grassroots first. And you talked about undergraduate, incorporating undergraduate family medicine, primary care into the systems for learning for undergraduate students. I could not agree more with that. I can offer my expertise as one of the co-directors of a leading medical university in the UK, and we work very closely with primary care and to try and improve undergraduate education around primary care. So certainly individually and collectively, we can help you with developing undergraduate programs or improving existing undergraduate programs. I think we believe in existing systems. So whatever is available on the ground, whatever people are doing fantastic efforts, as we saw earlier, we should join those systems, whether it's training initiatives, education initiatives, or elsewhere, and try and improve them from within. There is also an opportunity here for novel interventions. So we have this wealth of experience and expertise both in Pakistan, Australia, Europe, and in America. And I'm sure some of us or one of us will have a novel, brilliant idea which will literally hit the nail on the head. And I think we should use this as a singular symbiotic platform to share resources and share ideas and try and bring this faculty of people together, because why reinvent the wheel, as we say? If somebody has a great idea, maybe we can all work together and share our experience and expertise. I also believe in the principle of social accountability and dearly believe, and I think it is time for us to give things back, not just to our countries which we've made our second home, so for example, Britain or elsewhere, but also surely to Pakistan, because that's where our roots lie. So as a Pakistani diaspora, the leaderships of all these diasporas, we've already come together as my Australian counterparts have mentioned. We have actually signed an MOU between APPNA MERIT, the Australian counterparts, and APPNA in Europe to try and bring the leadership together, to think collectively, and also to work towards a common cause, which we all know is the improvement of primary care systems, and to put family medicine in a better position in Pakistan. And finally, partnerships. I think it is vitally important that we take on board partnerships, which are the nursing and allied health care. We cannot exist without them. And we know the importance of how nurses are so important, vital to the primary care systems and family medicine in and across the world. So certainly having the nurses on board is one key factor here. And I was so happy to see that our nursing counterparts are also part here. So going forward, without taking any more further time, I would say that individually, I'm very happy to help. Collectively, we are extremely happy to help as an APPNA organization. My General Secretary, Mr. Irfan Akhtar, was here as well. We've already spoken at great length about how we might want to take this forward. Also, Hisham Haq, Dr. Hisham Haq is our Social and Corporate Secretary. He's also involved with APPNA Merit as well, and he's a primary care physician working very hard on the ground here to develop programs. So moving forward, I look forward to working with all of you, both in Pakistan and across the world. So thank you for this opportunity.
Thank you so much. And to wrap up this panel discussion on family medicine, I want to invite our lead for the APPNA Merit Family Medicine efforts, Dr. Noreen Rafiq. Dr. Noreen is a program director of family medicine at Creighton University, our sister university in Omaha, Nebraska, where I practice in the University of Nebraska. So Dr. Noreen is working with many family practice physician experts in APPNA and APPNA Merit to develop different programs for family practice. And I would like her to summarize few of those efforts. So Dr. Noreen, please go ahead.
Thank you very much for the invitation. Thank you, Danish and Dr. Shahid Rafiq, Dr. Usmani, for getting me involved into this. It's a huge honor for me to be serving for my country in this respect. So the big task of creating a curriculum for Pakistani physicians, there's already been tons of work that has been done by so many prestigious institutes in Pakistan, and my little effort to add into that with the collaboration of all of you. So we did end up signing an MOU with Creighton University School of Medicine. The Dean of Creighton University School of Medicine enthusiastic about it. And so there will be also some help from the institute I am working at from the residency program. So ended up creating some skeleton curriculum that will involve some of the major aspects of family medicine as it has been differentiated. Family medicine being different from primary care. There are other disciplines, pediatrics and OB-GYN, who are also considered as primary care, whereas family medicine is a specialty in its own respect with emphasis on preventive care, addiction medicine, geriatrics, OB-GYN, musculoskeletal health. So these are very, very important aspects that we as family physicians do here that I would like to incorporate in the curriculum. So with the purpose of if a family physician is sitting in a small town of Pakistan, they are well equipped to do the preventive work, be able to diagnose and treat illnesses, and know the red flags to refer the patient to a specialist. So 80–90% of groundwork is done by a family physician. That's how it works here in US. And hopefully to get that established in Pakistan, that would be the big thing. The other part of the curriculum is obviously the faculty development. So with this curriculum, we will train the family physicians to train others. So it will be a comprehensive curriculum in which there might be some life courses, hands-on workshops, some traditional PowerPoints, lectures. So a very comprehensive curriculum that I'm trying to create here with the help of all of you so that we can get it established. Thank you very much.
Thank you so much, Dr. Rafiq. And I would only add that we are even looking at developing modules online through the APPNA Merits platform, APPNA Academy, that could be easily blended into various teaching programs in Pakistan in institutions through this collaboration. And we will share more details. I want to round up the conference today with the last 5-minute quick summary of the various ongoing projects beyond family medicine by APPNA Merit to give a very quick flavor of all the things that we're doing. And I will invite various team leaders or project leaders from from APPNA MERIT who are doing various different subspecialty projects outside of family medicine. So to kickstart that, I will invite Dr. Noor Mahal Kabani to share her work in various aspects of APPNA MERIT. Dr. Kabani, please go ahead. Dr. Kabani, you're muted.
Hi. Can you see my screen?
Not yet.
I'm trying to share it. Are you able to see my screen? Otherwise, Danish, you can go ahead and project it and I'll go through it.
Okay, let me share the presentation.
Okay, I think you should be able to see it now.
Yes, we can.
Okay, great. Thank you. Assalamu alaikum. This is Dr. Noor Mahal Kabani. I'm a pulmonary critical care and sleep physician with a special interest in telemedicine and tele-ICU, which I've been doing for the last 15 years. I am in Houston, Texas. And I'm very honored to be here and take you through this journey since March that we have been on since the COVID outbreak started, but it has evolved into a number of very useful and collaborative projects. I'm going to invite first Dr. Kaleem Ahmed to talk about our COVID webinars. Dr. Kaleem.
Assalamu alaikum. Can you hear me?
Ji Kaleem bhai, please also introduce yourself.
Assalamu alaikum. My name is Kaleem Ahmed. Also, like Dr. Noor, I'm a pulmonary critical care and sleep specialist. I am here in Maryland, close to Washington, D.C. And so when this COVID pandemic started, APPNA MERIT, as you all know, has been involved to promote collaboration between physicians from all over the world, especially from the US and Pakistan, and learn from each other experience. So with the COVID coming on, the leadership, Dr. Shahid and Dr. Danish has decided to how quickly we can develop a team of experts gather here and then start some program to help ourselves and also our colleagues in Pakistan to learn about this pandemic and see how we can help each other. With that in mind, we started a webinar series started on March 31st. And we did it almost daily basis initially. Every night here at 11 o'clock Eastern time and Pakistan time was 8 o'clock in the morning, where a panelist of different experts from different fields, including from pulmonary critical care, nephrology, cardiology, infectious disease, ophthalmology, psychiatrists, and so on and so forth. So we have covered almost every angle of COVID-related interaction with the physician and healthcare providers. And we did close to, almost daily basis. There was about 50 to 90 participants attended these webinars, almost 65 per session. And when the Ramadan started, then we, minimize it to Saturday and Sunday, and the timing was changed. And now we are doing it on Sunday. And with this discussion, we have about 5 different WhatsApp groups started, which has been involved in different type of discussion. And the wealth of knowledge has been shared from the latest review journal articles to the anecdotal reports, which was helping all of us in terms of sharing this information to help and take care of the patient in Pakistan and all over the world. So thank you very much for the opportunity, and I hope this project is going to continue and we're going to learn from each other and collaborate in future. Assalamu alaikum.
Thank you, Kaleem and Dr. Noor. I'm going to move into our next project, which is the COVID-related ICU case conferences. My name is Iqbal Ahmed. I'm a pediatric cardiac anesthesiologist at University of Texas Southwestern Medical Center. I also sit on the American Society of Anesthesiology Committee on Emergency Preparedness. And I've been very honored to coordinate these sessions. It came out of a needs assessment after discussion with colleagues in Pakistan who work in intensive care. An idea was really Dr. Jafar, professor at Wayne State University in Michigan. And the purpose is to have a two-way exchange of information to address management challenges in complex patients with COVID-19, the critically ill patients with COVID-19. Everybody teaches, everybody learns. And to help real patients faced by doctors with high clinical loads and little spare time. So far we have had a test session, a pilot session on June 13th with Ziauddin University in Karachi. And we've had 2 more sessions with Rawalpindi Medical University, Rawalpindi, and the Military Hospital, Army Medical Corps, Rawalpindi. And it has really been a two-way learning. We've learned about some of the real cutting-edge advances that Pakistani colleagues have some of the best data in the world, like stem cell therapy and therapeutic plasma exchange, and hopefully that will result in some contribution. Very grateful to our Merit faculty who have taken the time to be panelists and experts on this session. And I would like them to introduce themselves, starting with Fawad, if he's here.
Assalamu alaikum. Thank you, Dr. Iqbal, for the opportunity, and thank you, APPNA MERIT, for the opportunity as well. I am the interventional pulmonologist at University of Oklahoma, and I do critical care as well as sleep as well. So it's been a pleasure being part of this APPNA effort for the COVID-19 in terms of the COVID webinars and then the difficult case discussions. And as everybody else has alluded to, it has been a good learning experience, not only for the Pakistani colleagues, English colleagues, as well as for us sitting in US. We have learned from each other's experiences, and I believe all of us have helped each other. I think there are certain projects going on, and all these have been discussed. Some of the future things that I personally have been thinking which are in line and will go with that will be regarding interventional pulmonology in future. To establish some scope of that, and then establish some difficult case conferences regarding the interventional cases. And once the COVID settles down, I believe it will be mostly in the next year. I would like to basically establish some endobronchial ultrasound and esophageal ultrasonographic lung cancer staging and training. It could be hands-on with or without the real patients. And then medical thoracoscopy and some of the other interventional work, which includes the therapeutics in lung cancer, which includes lung stenting, rigid bronchoscopy, and tumor debulking that I do quite a bit here. I think that is something that will be needed in Pakistan, and we will hopefully establish that. That is the future goal for the interventional pulmonary collaboration. I do know a couple of other colleagues, Dr. Majid Shafiq, who has been involved, and I think he will be happy to be part of it. And then lastly, POCUS, which is point of care ultrasonography for ICU. That has been established on a forum under Dr. Mohsin Zaman and Dr. Rosie that I think they can discuss further. I'm not sure if they're on board today or not. So anyways, I think this is a very good forum, and I thank Dr. Shahid and Danish for making us all part of it for the improvement of the whole system and helping each other. Thank you.
Thank you. Fawad, is Dr. Faisal here to briefly introduce himself? Dr. Faisal Masood?
I am not sure.
I didn't see him on the panel.
Well, I would like to introduce him. He is one of the leaders in the field of intensive care. He is the director of the entire system of critical care in one of the largest systems in Houston, Texas. He's very involved in APPNA projects. He has created a collaboration with Khyber Medical University and Lady Reading Hospital in Peshawar. I would, if Majid Shafiq is here, please introduce yourself.
Ji, Assalamu alaikum. Thank you very much, Dr. Iqbal. Thank you very much to everybody. Such a team effort, of course, from different parts of the globe, spearheaded by APPNA on our side over here, for doing whatever we can and really thinking outside the box to help learn from each other and contribute as part of a team for the ultimate benefit of patients. It's truly been a pleasure being part of, having been part of, all these efforts for the past 3 months. 3 months ago, I personally knew nothing about APPNA, but it's really been a pleasure, being part of those webinars and these case conferences and looking at tele-ICU, etc. So I am a director of interventional pulmonology at Harvard's Brigham and Women's Hospital in Boston, and part of the organizing committee for the American Association for Bronchology and Interventional Pulmonology, where I help organize and teach at simulation-based courses related to some of the, the clinical aspects of interventional pulmonology that Dr. Fawad Chaudhry very eloquently alluded to. I'm also a medical educator at Harvard. I completely agree with the focus on primary care. That was a central theme for today. And also, one of my favorite things has been to sort of help, look at difficult, challenging cases together and learn from each other. One of the newer initiatives that APPNA MERIT has started recently. I look forward to great things ahead. Like Dr. Fawad said, certainly, you can count me and I'll be happy to organize, help teach at interventional pulmonary or ultrasound-based courses. And of course, certainly as a critical care specialist as well, we'll be happy to continue, helping out in whatever way I can with the ICU-based initiatives. Thank you and great job.
Thank you very much, Majid. I'll request Wes Masood. Dr. Wes Masood is Program Director at Jersey Shore Medical Center. If he's here, could you please introduce yourself and your experience? Thank you.
Thanks, Iqbal, and thanks, everybody. I'm Wes Masood. I'm an intensivist and a nephrologist. I'm also a Program Director of a fellowship program, which is a nephrology critical care program. And obviously we trained fellows in nephrology and also in critical care. So as we all know that we were hit hard in New Jersey, starting from March. For the next 2 or 3 months, we have been, treating a lot of patients. And after that, actually at that time, I got involved, and thanks to Shahid and the team, that we were discussing with our colleagues in Pakistan and in mutual learning process, which I personally learned a lot from. And then we realized that this media, through this media, we can do a lot. On sky is the limit only. So after that, just last week, Shahid and I discussed. So I said that let's move to a subspecialty discussion panel, which is nephrology. And I already spoke to Pakistan Society of Nephrology, very learned and very active nephrologist in Pakistan, Dr. Ahad Qayyum. I spoke to him and we made a plan that I will make a panel here, nephrologists who are in education or in academics, and we will inshallah make programs for mutual learnings through Zoom and through webinars. So I will, in coming days, I will let you know there are more details about that. My other area of specialty is hypertension, and I'm sure that in future, I'll be involved if I need to be in family practice education. As we all know that hypertension is a very common condition, and the primary care or family practice physician need to treat that and need to prevent that. Thank you.
Thank you very much, Wes.
Dr. Iqbal, sorry for the interest of time. Let me quickly speed things up and so that we can go towards closing. And we are already way above time. So let me quickly invite Dr. Mohsen Zaman to introduce himself and his ongoing work before I move on to other person.
Thank you. Hello, everyone. Thank you for the privilege and the pleasure of working with APPNA MERIT. And I'm grateful to Dr. Amar Berni for introducing me to the organization almost a month or so ago. In that time, I've had the pleasure to work with Dr. Kabani. I've had the pleasure to work with Danish, Dr. Shafiq, Dr. Iqbal, Dr. Fawad, and it has been a pleasure really working with you people. I am going to talk about what I have been doing for the last few weeks, which is primarily supporting the training program that we are developing for critical care nursing. For that, we are going to actually, we are fairly sure that we'll be starting one of the sessions on a nursing webinar from the 11th of this month, and hopefully deliver a proper training program from September. Along with that, of course, we are going to start doing some stuff on POCUS and see how things go. Is that quick enough?
Thank you, Dr. Mohsin. That was perfect. Let me invite one of the APPNA Merit co-chair, Dr. Babar Rao, to talk about his work in telemedicine in dermatology. Dr. Babar, please.
Gee, thank you, Shahid and Danish. Wonderful job. So there are many people or many doctors related are from Pakistan trying to do telemedicine at different level in the country. And at APPNA Merit or APPNA, we're trying to see what is the best fit for us. So we basically trying to centralize maybe a teleservices from APPNA to Pakistan, but I'm working on it. One second point is I am a lead person appointed by Shahid and Danish for research for merit. So anybody interested to collaborate in research at your level in Pakistan, wherever you are, or England or Australia, please shoot me emails. I'm babarrao@gmail.com and we'll get started. Thank you.
Thank you, Babar bhai. And then let me invite another co-chair for APPNA Merit, Dr. Waqar Azim. Professor Waqar, please go ahead.
Assalamu alaikum, everyone. Thank you, Danish. Just very quickly, we're doing psychiatry stuff or mental health stuff with Pakistani colleagues for last 10 years. I think the biggest thing what we have done from APPNA Merit along with our colleagues in Pakistan is developing child psychiatry, FCPS, with College of Physician and Surgeon Pakistan and with all our colleagues. Most recently, we have done webinars to support our frontline staff, and I'm so happy to see our residents will be taking the lead on doing the next webinar in this case. We know mental health is a crisis, and we appreciate all the support from APPNA Merit and all of our colleagues in Pakistan. Thank you.
Thank you so much, Professor Waqar. So this concludes for all the discussions and introductions for today. And before I invite for the closing comments, our president-elect, I want to quickly say that you can find more information on APPNA Merit at our website, appnamerit.com. You can reach out to me, to Shahid, to any of us for any collaboration. We couldn't cover all the aspects we're working on. We have a lot of work going on in research collaboration and research partnership. In addition to family medicine, we have work going on in cardiology, in infectious disease, in emergency medicine. And I would let Dr. Shahid make any more comments before we conclude. Dr. Shahid, please go ahead.
Yeah, Danish, I would actually yield just 1 minute to each Junaid, Razak, and Mariam Watan, because they have done or have great plans. So I would like to yield my time. I think we'll close after that. And Rizwan Khalid, actually, our president-elect, is the one who will be closing and letting us know about his vision and for 2021 and merit. So Junaid, if you're there, can you please talk, and then Mariam for 1 minute each.
Sure. Thank you, Shahid Bhai. Thank you, Dr. Danish. And big thanks to Dr. Nahid Usmani and Dr. Rizwan Khalid. Emergency medicine, like family medicine, has a huge need. Pakistan does have an FCPS in emergency medicine for past 7-8 years. We estimate Pakistan needs about 20,000 trained emergency physicians, and currently there are about 8 or 9 trained in Pakistan. So there's a huge gap. There's a big need, and probably no other country in the world needs emergency care more than Pakistan. And I'm just saying it because of experience and numbers that I look at as part of my job here at Hopkins. APPNA Merit for emergency medicine is very, very new. It's probably not born yet. We don't have an announcement yet. So hopefully soon that'll be online. And we look forward to getting all the support we need. in the short run, we are looking at organizing an international conference with colleagues in Pakistan. There's a very dynamic group in Pakistan, and many of the leaders here have supported that group, sort of very early on in its life. We are also very interested in not only capacity building at the individual level, but also institutional capacity building. I think both the training perspective and research and academic perspective is a huge need, and Pakistan can really take a lead in this. So I'll just end with inviting you to this meeting in September. APPNA Merit will be part of it, inshallah. So would our colleagues in the UK, in Australia, and other places. And looking forward to working with you all. Thank you so much.
Thank you, Junaid. Mariam, Dr. Moten, if you're there, please, in 1 minute.
Assalamu alaikum. It is humbling to be part of this esteemed group. I see the enthusiasm and eagerness of the organization, the chair and co-chair of APPNA Merit Group. It pales our input. APCNA will continue to participate. All the members have a plan to give lectures and continue with participating in the APCNA platform underneath APPNA so that we can help in the education by giving lectures in cardiology in Pakistan. As you know, Cardiac Pacemaker Bank is the APCNA's signature effort in Pakistan. We provide pacemaker free of charge to those in need in select institutions that have been screened for adequacy of implant and follow-up. 1:1 training is provided for pacemaker, coronary, and valvular intervention and EP procedures in Pakistan. As far as APPNA Merit Program for Family Practice and Primary Care is concerned, we will be lining up talks for 20 minutes duration with a few questions in the beginning for the trainees to be recorded with PowerPoint slides and will be put into APPNA Merit signature database of talks. We plan to cover topics that are applicable to Pakistan based on its resources. There seems to be a great interest to a standard educational lecture series in Pakistan for cardiology, and we are honored to be part of this endeavor. Thank you.
Danish, if I think nothing else, then Dr. Rizwan Khalid can close, but I see if Dr. Masood Gondal had raised his hand. If it's correct, then maybe Danish, you can give them a chance to.
Ji, please, Dr. Khalid Masood Gondal sir.
नहीं, मैं I think Professor Bilkis शायद बात करना चाह रही थी.
Sure.
Please,
I think
go ahead.
Bilkis is our head of medicine. Please.
The hand I'm chairperson be delighted to share with you the medical university started masters in nursing and planning PhD, inshallah.
I think we dropped Professor Bilkis. We'll follow up with her and get the details. I think she was talking about some collaborations and would be so looking forward to it. And we've already reached out to Professor Bilkis for one of our webinars, and we'll look at many other projects with you, Dr. Khalid, at your institution. Thank you so much. So let me invite Dr. Rizwan Khalid, the President-elect of APPNA, to give his closing remarks. Dr. Rizwan, please go ahead.
Again, ji, Assalamu alaikum. If anybody did not hear me in the beginning, Assalamu alaikum, good afternoon, good evening to all of our attendees, panelists, and a very honored, very illustrious group of guests. I'm very happy to see all of our head of institutions from various parts of Pakistan, vice chancellors, principals, head of department, the chair of the HEC, Dr. Faisal Sultan, Professor Reglo, representatives of our sister organizations in the UK and Australia. So I'm very thankful to all of you to come on a Saturday weekend and participate in this very important conversation and team building that APPNA Merit has been focusing on. I think also I want to recognize all the APPNA Merit team. You know, I would be amiss if I don't recognize the APPNA Merit team, which have done a phenomenal job. All the chairs, the co-chairs, the leads in different subspecialties, Dr. Junaid Razak, Dr. Majid Shafiq, Dr. Fuad Chaudhry, Dr. Noor Mehel. Very, very happy to participate in APPNA Merit's program. Danish, I'm trying to share my screen, and this is just one slide that I wanted to share, if you allow me.
Ji, please go ahead.
Primarily be what this is trying to summarize what we have done, especially from a family medicine perspective. I have not put in about other specialties that Dr. Junaid Razak and the interventional pulmonology, Majid and Fawad were speaking, Dr. Wes Masood, Dr. Babara. So I have not put those things on this, but this was primarily to focus on the family medicine initiative that APPNA has taken. So it is imperative that we all understand that this focus is Pakistan. We are not focusing on any of the other parts of the world. This is not UK, Australia, or the US or Canada. And the focus for this particular initiative is family medicine, which encompasses a lot of other parts of medicine, preventative care. But primarily this particular initiative is focused on Pakistan. It's focused on family medicine. The other thing is that we do not want to reinvent the wheel. We do not want to, we have models available. There are models and Dr. Nasir Shah shared with me in Pakistan, there is a working document that is available. We do not want to reinvent the wheel. And we want to do the work with our local stakeholders. You know, that is the reason we really emphasized on our universities in Pakistan, our hospitals in Pakistan, the medical colleges, other stakeholders, including the College of Physicians and Surgeons, the PMDC. So it is very, very important that our local stakeholders take the lead, and APPNA Merit, APPS, Northern England chapter, Australia, we provide the support. We share the experiences that we have. I'm not from family medicine, but our family medicine teams and we share our expertise. However, we want to make sure that the local stakeholders are empowered, and they are the people that make the decisions. And I'm going to support that next year. We do not want to import a model and put it in Pakistan, whether it's from the UK, the Scotland, it's from Canada, the US, Australia. It doesn't work that way. It only works if there is a partnership, if there's a collaborative partnership in which we take a model from the ground up and build it up. And and APPNA Merit obviously will provide the hub, and global collaboration is the key. We all learn from each other. COVID-19 is the example of that. That when we all learn from each other across the globe with our experiences, so global collaboration will certainly make this succeed further. I have put in my email. That's an underscore at yahoo.com. That's my WhatsApp. I'm more than happy to participate with any of the panelists and attendees this year. Again, congratulations to APPNA Merit and all the other panelists that have joined us. I'm praying and looking forward to a successful program going forward. Thank you very much, Dr. Bhatti and Dr. Shahid Rafiq.
Thank you so much. I think with this, we conclude for the meeting for today. We went over time, but thank you so much for staying with us. It was so good to get to know each of you and meet with you and learn from all the work you're doing. Please reach out to us, and we're looking forward to future collaborations. Thank you, and Assalamu alaikum.
Assalamu alaikum, and thank you very much.
Assalamu alaikum.
Thank you.
Khuda Hafiz.
Khuda Hafiz. Assalamu alaikum.
Assalamu alaikum. Khuda Hafiz.
Assalamu alaikum.